today, Boris Johnson will unveil his long-term plans for social care and the NHS. But reports of an increase in national insurance to cover the cost, which would break his commitment not to raise taxes at the general election, has led to anger from Tory MPs.
ITV News' Paul Brand is here in the studio to explain the situation. Morning, Paul. So, look, try and explain why people are so opposed to this increase in national insurance.
Yeah, morning all. I mean, the Prime Minister says he wants to end the catastrophic cost of social care, but the big question is, what's it going to cost the rest of us? So, if you earn between £9,500 and £50,000 a year, currently you pay 12% national insurance on those earnings. But once you get above £50,000, well, you only pay 2% national insurance on those earnings, which is why we're getting this argument about national insurance targeting poorer and also younger taxpayers more. Now, the government's looking at increasing national insurance by about 1%. We think actually probably 1.25%. If you're on the average earnings of around £30,000 a year, that means you're going to pay about £200 more in national insurance. Whereas if you're a pensioner, for example, on, say, £60,000 a year, you pay absolutely no national insurance whatsoever. Where else could the money come from, though? Well, I think the government will look today at perhaps extending national insurance so that working pensioners do pay it for the first time. Others, though, say, why don't we look at income tax? Why don't we look at inheritance tax, capital gains tax, the kind of taxes that target wealthier taxpayers more? National insurance is a tax, but most people don't see it that way, though, which I think is why the government's opted for this option.
Paul, you have done incredible work on what has been happening in social care and in care homes, particularly highlighted throughout the course of the pandemic, of course. It's been catastrophic, you know, in residential care homes. And also there's lots of people who are going to need long-term social care who aren't in residential care, who want to stay in their own homes. So you know, sort of right at the front line, how important these changes are, and they've got to be funded somehow, haven't they?
Yeah, absolutely, Susanna. And I think we're so focused on the finances today. It feels a bit like Boris Johnson slipping us the bill without telling us what we're actually paying for. You know, what is he going to do about the quality of care? What is he going to do about the availability of care, the millions of people still waiting for care? What is he going to do about the unprecedented staffing crisis in the sector?
Which is about to get under more pressure because, of course, in November there's going to be the compulsory vaccine requirement. And presumably a lot of people will leave the care sector because they don't want to take the vaccine for whatever reason.
Absolutely, and there are already tens and tens and tens of thousands of vacancies. And we went out with carers last week on the front line. Every single carer I interviewed broke down in tears through the frustration, the desperation, the exhaustion of what they're going through right now. They're working 90-hour weeks, some of them. One of them told me they tried to resign 5 times, had the uniform thrown back at them, told, get back out on the front line, we cannot cope without you. So for me, although there's a lot of focus on the finance today, I want to know what is Boris Johnson going to actually do with that money as well.
I think one of the things that you highlighted as well, Paul, on social media yesterday was the idea that potentially you could have a carer on minimum wage with the increase in national insurance could be paying for the care of a wealthy care home resident that they're looking after.
Yeah, this is the really difficult thing, and I spoke again to some carers yesterday who said they do feel that's unfair. What kind of thanks is that for everything they've done during the pandemic, that they will now have to contribute? I mean, they can see themselves the importance of properly funding social care, but the question is this the fairest way of doing it? The problem for Boris Johnson, though, is that, you know, he's grappling with questions that no one's found a popular answer to. We could go back to talking about inheritance tax, for example. Well, Theresa May's so-called dementia tax didn't go down too well either. So there's just no good way of sort of swallowing the bitter pill here, the fact that we do need more funding for this sector.
Yeah. All right, Paul, thanks very much. Let's talk to journalist Ash Sarkar, who says increasing national insurance is an unfair tax on young people. Former Health Minister Edwina Currie says it's the quickest, simplest way of raising the money that we need. Very good morning to you both. Edwina Currie, that contrast between someone who is on a low salary having to pay a disproportionate amount towards the care of someone who may not be funding social care seems the essential unfairness, doesn't it?
Well, what Paul didn't mention, of course, is that people on with incomes of over £50,000 are paying a much higher rate of income tax already. And of course, an elderly, wealthy person in a care home has probably had to sell their house in order to pay for it. The point is that we do need to do something about the care sector, raise salaries, increase recruitment, raise the training, raise the status of care. And of course, it's not just for old people, it's for younger people with disabilities as well. And if we're going to look after millions of people better every week, then the best way to pay for it is for millions of people every week to be paying a little bit extra. And bear in mind, of course, that this goes up at the moment until the age of 66. So any suggestion that it's just young people paying for old people, that's not true. That's not exactly how it works. And we need to raise the money consistently and as cheaply as possible, which will work with national insurance. And that's what national insurance was originally intended for health, for social care, to look after us when we need it.
Ash, it's a tricky situation that successive governments have managed to avoid. Boris Johnson is doing his best to get a handle on it, at least try and find a solution, no matter how unpalatable it's always going to be, because it needs sorting, as Paul very clearly depicted. And what Edwina's saying is, look, this is a quick, simple solution that actually would start to try and make a difference.
Well, I'm really glad that we're all in agreement that the social care system needs sorting out. For too long, it's been the poor relation of the NHS. There's not been enough money. And also, when it comes to interacting with the social care system, it's often very distressing, it's confusing. And for example, if my granny, God forbid, had a heart condition, it would be very straightforward. She goes to the NHS, she gets her care free at the point of use. In the social care system, it's suddenly incredibly bureaucratic. She's having to, pay potentially tens of thousands of pounds before the state kicks in. And it's like the worst of the American healthcare system. So I'm in full agreement this needs sorting out, and it needs sorting out urgently. But you can't do it by making the poor pay for the rich. And the way in which it should be done is by taxing wealth and not wages. We've had stagnant wage growth in this country for well over a decade. People aren't enjoying hugely, generous pay packets compared to 10, 15 years ago. But where there is wealth and where there is something which can be taxed in order to pay for this really critical service is property values. That's been going up. You've had a 50% increase in the wealth generated from second homes, just second homes, in the past 20 years. So we need to look at a wealth tax. We could also look at equalising capital gains tax with income tax. That's not a socialist policy, by the way. That's a Tory policy from 1986. Nigel Lawson came up with that one. That would bring in £90 billion over 5 years. A 1% tax on millionaires would bring in £260 billion over 5 years. So there are fairer ways to do this. This policy, unfortunately, would mean that a shelf stacker at Tesco would be kicking in more for the care of an elderly retiree, potentially, than a millionaire. That's simply not fair.
Edwina Curry, it's a compelling argument, isn't it, that actually, the basic principle of a fair tax is that it is a little bit more onerous on those who have more.
Yeah, but the idea that a shelf stacker is going to be contributing more than a millionaire to the exchequer through this increase is a load of nonsense. The millionaire has to contribute.
If the millionaire, for instance, gets their income from dividends or investments or property and not from income, then that's the case, isn't it? From wages.
No, it's absolute nonsense in terms of the absolute amount of it being given by individuals. It's the shelf stacker would be paying a lot less. And believe me, the shelf stacker may be the one that needs care in future, as the millionaire will, and will need all of us to be contributing to that. The key thing is we need that money in now. We don't need it in 2 or 3 years' time when property values work their way through into inheritance tax. We need the money in now. We need it in reliably. We need very large sums of money. 10 billion will come in very quickly through this very small increase in national insurance. Anybody on less than 9,500 a year, as Paul said, which would be a lot of part-timers, is not going to be paying. And I, for one, would be perfectly happy to see an additional increase so that those of us who are pensioners who are working should be paying it. I think we would all accept that, not least because we know you know what, we might need it.
Okay.
We all know something.
OK, so you would argue for the threshold to not stop at 66. You think that people over 66 should be paying national insurance?
I'd be happy for that. I mean, it would directly affect me. And I'd be happy to say, look, you know, if I'm working, if I'm earning, then the national insurance rate should apply to me at the same rate as it would if I was younger. But actually to bring in the bulk of that 10 billion, the first tranche of which would go to help relieve the backlog in the NHS, to get that money in, we really need to get cracking with every working person being able to pay into it above a £9,500 threshold.
Edwina, do you have any uncomfortable sort of sense about the fact that this is breaking a manifesto pledge, which is one of the reasons that Boris Johnson got the job in the first place? And this is a sort of with regards to what he promised wasn't going to happen?
Oh, Ben, you know, all Tories hate putting taxes up. We really do. But the pandemic wasn't in the manifesto either. And the government really, I think, rose to that challenge very, very well indeed. After,
social care has been an issue since before the pandemic emerged, though, hasn't it?
Yeah, absolutely. And you cannot solve the question of how we look after older people, disabled people, how we reform the care system, not only in homes, of course, not only in residential care, but care in people's homes, as indeed we had for my husband when he was very ill the other year. You can't resolve that issue without actually biting the bullet of charging people more and putting the money in the exchequer, making sure it goes where it's needed.
You can see, Ash Sarkar, that this is already being spun as a sort of affordable £5 a week extra. You know, if you look at the briefings today in the papers. But also, according to, there was a survey, a poll done on this last night, this isn't unpopular amongst the voting public. So, you know, while we look at the fact that backbenchers, and as Edwina Currie says, there are a huge number of Conservatives who are saying we do not want to put up taxes and we do not want to break a manifesto pledge, they might bite the bullet because it needs to be done and people are not overwhelmingly opposed to it.
People can only respond to the choices put in front of them. And I think that polling, that supportive polling, reflects just how important it is that we get social care sorted out. Of course, not everybody who needs social care. In fact, half of people who need social care are of working age, but we do have an ageing population. This is only going to become more important. We've got 1.4 million people not accessing the care that they need. And you've also got millions of unpaid carers in this country, usually looking after relatives. So I think that that's what that polling reflects. But what's really important is that it's done in a fair way. Edwina, I'm sorry, is being completely disingenuous when she's pretending that the only way to tax wealth is through inheritance tax. That's simply not the case. I gave you two policies which could be implemented tomorrow if the Chancellor wanted, of equalising capital gains and income tax and also having a 1% tax on millionaires, which would bring in money immediately in a way that is fair.
Well,
because right now...
OK. We'll put those points to Nadeem Zahawi because he's our government minister this morning. And in order to get to him, I'm afraid we have to bring this debate to a close. So thank you both very much indeed.
Thanks, Ash. Thanks, Edwina.
Thank you.